Hi everyone, how are you? Welcome to another question and answer session. This is a physiology part of MRCS. This is the question: which of the following does not cause hyperkalemia? So we have to find out option which is not responsible for increased potassium level in blood. Not causes hyperkalemia. That means which is not increase the potassium level in the blood. Here the options are hemolysis, burn, familial periodic paralysis, type 4 renal tubular acidosis, and severe malnutrition. So we have to find out one of the options which is not causes hyperkalemia. That means which may cause hypokalemia. So first of all, here we can see the blood level of the potassium level. Here this is a cell. Here we can see this is a myocyte or any other cell, and in this condition we can see the potassium it present 150 millimole in the cell. On the other hand, the potassium present in the extracellular fluid or in the blood it is 4 millimole. So the potassium is very abundant within the cell and very less in the blood and extracellular fluid. So it is now clear that the cell they are very rich in potassium. That means they are back of potassium. A lot of potassium present in the cell in relative to the outer side of the cell. So if any causes which destroy this cell, this huge number of potassium, that means 150 millimole potassium it released to the extracellular fluid and into the blood. So in this condition the blood potassium level will increase when there is destruction of the cell. So it is one of the most important concept to remember, that the any condition which causes destruction of the cell, it increases the potassium level in the blood and which causes hyperkalemia. Here we can see the causes of the increased serum potassium. That means the causes of the hyperkalemia. Here on mnemonic, which is the machine medication such as the angiotensin converting enzyme inhibitor and NSAID. SA for acidosis, metabolic and respiratory in case both. C for cellular destruction such as burn, traumatic injury. H for hypoaldosteronism, hemolysis. I for intake, that means excessive intake of potassium. N for nephrons and renal failure, that means the renal tubular acidosis. And E for excretion impaired. So here we can see the causes of the hyperkalemia: acute renal failure. We know that the kidney is an important buffer and it has longer time than blood buffer, and when there is a renal failure occurs, then the potassium will increase in the blood. Then certain drugs such as the potassium sparing diuretics, ACE inhibitor, angiotensin 2 receptor blockers, spironolactone, cyclosporin, and heparin. Then we can see the metabolic acidosis, both the metabolic and respiratory acidosis, they causes the hyperkalemia. Addison's disease, another important cause of hyperkalemia. And here we can see the tissue necrosis, rhabdomyolysis, burn, and trauma. In all this condition, that means the tissue necrosis, that means the destruction of the cell. Rhabdomyolysis, that means the destruction of the muscle cell. Here we can see the burns, which also destroy the cell. Trauma, it may also cause the cell destruction. So in this point, that means the all type of cell destruction it causes increased potassium level. And also the massive blood transfusion also increases blood potassium level, because the massive blood transfusion, that means about 5 to 6 liter of the blood, and we know the blood cell, that means the RBC, WBC, and platelet, they are continuously destroying within the blood bag. So in this condition also, that means in case of blood transfusion also, the cells of the blood, that means the RBC, WBC, and platelet broken down, and potassium from the cell it enters into the fluid of the blood bag. So in this condition also there is risk of increased level of the potassium. Here you can see the periodic paralysis. It may be primary and may be secondary. Primary, it is the familial cause of periodic paralysis, and here we can see the causes of primary periodic paralysis. It may result from the hypokalemia or hyperkalemia. So in this condition also, that means in the periodic paralysis, there also may be increase of potassium in the blood. And here we can see the renal tubular acidosis. Renal tubular acidosis, that means it is the acidosis, and this acidosis is actually in the blood or in the blood. So the acidosis in the blood occurs due to renal tubular dysfunction. It is called renal tubular acidosis. This acidosis within the blood, not in the kidney tubule. So the renal tubular acidosis, it occurs due to malfunction of the kidney tubule or any other hormone. And there are four types of the renal tubular acidosis. One of them is type 4 renal tubular acidosis, and here we can see the renal tubular acidosis and type 4, it also known as the hypoaldosteronism and hyporenism, and it causes hyperkalemia in the blood. So renal tubular acidosis, it also causes hyperkalemia in the blood. And here we can see the causes of the hypokalemia. Here we can see the hypokalemia, it is also important. Hypokalemia, it may caused from the excessive loss of the potassium and inadequate intake. So excessive loss is may occur through the diarrhea or vomiting, fistula or suction, diuresis after acute renal failure, Cushing syndrome or steroid use. So these causes, they are cause of the decreased level of potassium in the blood. And the second option here, we can see this is the inadequate intake. So when there is inadequate intake of potassium, it also reduces the blood potassium level. Here we can see the malnutrition. It is the most important cause, because in case of malnutrition, all types of the food, all type of the electrolyte, vitamin, minerals, they are reduced in the blood. So all the component of the food or all the component of the blood parameter, they are reduced when there is malnutrition. There are alcoholism, anorexia or restrictive diets, inadequate IV replacement during the TPN, that means total parenteral nutrition. So here our option is ready, which is not causes hyperkalemia, that means which is responsible for decrease blood potassium level. And here we can see the severe malnutrition, because in case of malnutrition, all type of the blood parameter will usually reduce, and all the food material, that means the product of the food materials such as the carbohydrate, protein, fat, and also the metabolizing agents such as the vitamin, minerals, they also reduce in case of severe malnutrition. And here we can see hemolysis, that means destruction of the blood cell. That means this is the blood cell, and blood cell is rich of potassium. So when destruction of the blood cell, there increased level of the potassium. Also burns, it also cause cell destruction. Familial periodic paralysis, it may also cause the hyperkalemia. Renal tubular acidosis type 4, which also cause the hyperkalemia. So here the severe malnutrition and malnutrition, severe malnutrition, it decreases the blood potassium level. Thank you all.